We wanted to explore the thesis that if we could deliver a result the next morning, that would be timely enough to change how physicians use infectious disease detection to change therapy. We were fortunate in mid-2022 to be introduced to folks at UPS Healthcare, and specifically the group within the Express Critical team, who had a program called Early Extraction.
When I started meeting with HealthTrackRx, I quickly realized that they really wanted to get their testing done more quickly, to deliver the lab specimens for testing to occur. It's a little shocking, right, to move from Denton, Texas, all the way over into Kentucky or Indiana. It's a big change within their operation and a big commitment.
We had no presence in Louisville. We came here because of the promise that through this UPS program, we would be able to deliver a next morning result. But candidly, we weren't sure how that would work at scale.
We put together a very effective solution for them. We did get them to move closer to our Worldport location, and by doing so, we're able to provide an early extraction process out of our Worldport straight into Indiana, and with the first delivery at 1 a.m.
We take the package at 1 a.m. They deliver it in our lab in Louisville, whether from Seattle to Miami to Maine to Southern California. We can begin processing those overnight, and by 9 a.m., wherever that patient lives, have a result for them the next morning.
The onboarding was very simple. We were set up within a week, and using the testing, had results the next day.
We conducted an independent survey of how physicians were actually using our test to treat patients. And what we found was, in 48% of the cases, physicians were actually withholding any prescribing at the point of service. And by doing that, in about half the cases, prescription wasn't necessary. That's a tremendous validation for the work that we do here to change how physicians are thinking about treating infectious disease, and more importantly, eliminating patients taking prescriptions they don't need.
Since we started using HealthTrackRx, we have fast results the next day, and then we know definitely what treatment to put them on.
That has been just fantastic to see, so that the patient's not on the wrong medication. Everything we're doing as UPS Healthcare has helped that patient need, and then ultimately, HealthTrackRx is doing a great thing.
I think it's helped with patient satisfaction. Patients seem very willing to participate in the HealthTrackRx swabs and are very excited to know exactly what they have.
Reducing the amount of unnecessary prescriptions and having more of those prescriptions targeted to the patients who need them, we're really able to help bend the curve of how we will treat infections going forward.